And welcome back, viewers. It's great to be back with you. We are in the Edinburgh Conference Centre at Renaissance with a very special guest, Dr. Beto Gutierrez. Beto, great to see you again.
Thank you, sir. Thank you for having me.
So we're here because this year you retired, and we want to talk about your career in healthcare and all the great work that you did at the Hope Clinic over the years.
Okay. Steve, I'm still working at the hospital, but I retired from the Hope Clinic after 24 years a month ago.
And it was a very moving send-off from that party they held for you.
It was very humbling, and it was, I got kind of teary-eyed, Steve. It was a wonderful going away, and I miss it. It was wonderful working 24 years, taking care of very poor people that couldn't afford to see a doctor, and people coming in with all kinds of complaints, from colds to sore throats to gangrene to cancer. And it's been a wonderful experience knowing that I played a small part in their health care, especially knowing they couldn't afford to go to a private doctor. And
let's start off. Tell us a little bit about your career before you got to the
Sure.
Rio Grande Valley, if you would.
I was born and raised in Rio Grande City, Stark County. And since early on, I've always thought I wanted to be in healthcare. Went to University of Texas and got my degree, then went on to Galveston Medical School. Graduated from there, and I'm so old, Steve, that when I graduated, there was no residencies for family practice. 1967, all they had then was called an internship, 12 months of medicine and then into private practice. 3 months in every discipline, surgery, medicine, psychiatry, so forth. And my wife did not want to come to the valley, so we settled in Carlsbad, New Mexico. And I was the only Hispanic in town, and it was a little difficult getting started. I walked the streets. I did the walk and I did the talk. And finally, after about a year and a half, 2 years, I was blessed to be able to see about 80 patients a day. And then I started delivering babies, delivering 20, 25 babies a month. And I did that off and on for 30 years in Carlsbad, New Mexico. While I was there, I did volunteer. Several organizations. I volunteered to be a public health officer. I had a lady and I also started a program called Christmas Anonymous, creating gifts for poor people at Christmas. And we had up to 4,000 people come in for their free gift my last Christmas there. So in a summary, my dad, who lived in Rio Grande City, asked me to come home. Son, you've been gone 40 years, please come home. I'm 90 years old. I want to see more of you. So I came home. He passed away 2 weeks later. Then I moved to Zapata, Texas for 3 months, and it didn't work out. Moved to the valley, and I've been here ever since. 24 and a half years ago, I was having lunch with a man named Alonso Cantu. And we're talking about the valley. And he says, would you mind going over to the Hope Clinic? They need help. I said, what's the Hope Clinic? Go find it. Somewhere in South McAllen. So I searched and I found the Hope Clinic. And I volunteered to treat poor people. And about 15, 16 years ago, I became medical director. And I was there ever since. And after 24 years and 84 years of age, I retired a month ago. And I had a wonderful lady take over for me. But it's been a very fruitful a very humbling experience taking care of people that are so poor that cannot afford to see a private doctor. And we treated them as I did my private patients in the office, always with a lot of respect and dignity. And I had a wonderful staff helping me at the Hope Clinic. By the way, I'll throw this in. The Hope Clinic was started by a nurse and a priest 28 years ago for the same reason, to try to treat people that could not see a doctor. And I'm sure you know, Steve, that the valley, the county, Hidalgo and Stark County are in the top 10 in the whole United States as being the poorest counties in the United States. So we have a lot of unfunded folks here in the valley. And again, what I did, I volunteered once and twice a week to see patients at the Hope Clinic, whole families. And again, some people don't know that diabetes is one of the worst things that we have here in the valley. Diabetes nationwide, 19-20%. Here in the valley, it's a little over 50% are diabetics for different reasons. So our goal at the Hope Clinic was to keep that diabetes sugars under control. Obesity is another problem. Hypertension, another problem. And I'm not trying to brag, but I feel good about trying to get those people under control, give them a few more years of life. And by the way, as we're talking about it, I miss not being at the Hope Clinic anymore. In essence, it's been a big part of my life.
And you obviously miss the clinic and the staff there that you work.
I miss the staff. I became very close to a lot of the patients. Some of them were with me for 10, 15 years, the same ones over and over. And it was very heartwarming at my farewell party that we had 3 weeks ago to see those patients show up. And we both had tears in our eyes, knowing I probably won't see them again. I still work for DHR. I'm doing consulting work. But the Hope Clinic will always be very, very close to my heart.
Let me ask, when you first got to the Hope Clinic, were you aware just how high a percentage of people that needed help that had no insurance, nowhere to go?
I did not, Steve. I did not. Arriving from, I've been out of the valley for 40 years. It changed a lot. I had no idea the number of poor people that we have here in the valley. And so I almost felt like a duty, a privilege, and a duty to be able to deliver health care to these poor people. And I think I'm a better person for it. Just treating them, and when they say thank you, gracias, knowing that they didn't pay a penny, and getting what I think was good health care. So yes, I do miss it, and hopefully it'll keep on going. We had trouble a few years. In fact, 15 years ago, we were broke. We are not affiliated with the government in any way. We depend on donations and grants. We were broke. And so I met with this man, Cantu, and he had a lady named Marisa Castañeda start Fishing for Hope tournament, raising money for the Hope Clinic. And every year it gets better. This last year, our tournament gave us almost $400,000. And it cost us about $100,000 a month to take care of poor people, paying the staff. And somehow, when I joined the Hope Clinic 24 and a half years ago, we had 4 doctors on board. Slowly they retired or left, and I was left as the only one. Very busy, but then, as you know, the medical school came into the valley, and the residents came over to help me. And that's been a big, big help. The numbers of unfunded patients continue to grow. I think last year we saw, 8,000 patients at the whole clinic. And the numbers keep rising, as you know.
I was going to ask that. So 24 years later, from when you first got there to today, we covered an event recently where we were told that the poverty level in Hidalgo County has actually dropped. In the last 5 or 6 years, Hidalgo County Judge Richard Cortez has made a big effort to attack the poverty level, and it's gone back down by about 2.4%. Not a lot, but still, exactly, it is improving. But from listening to you here today, the problem is still a huge issue. There's a long way still to go.
Big problem. It'll never go away, Steve. In fact, one thing that was interesting, during COVID, I saw people with college degrees who couldn't afford insurance anymore. That surprised me. I saw teachers, engineers, very embarrassed having to come see me at the whole clinic because they could not afford insurance. And I was glad I treated them like I did everybody else. But no, you're right. Poverty will always be here. I just checked on it recently, and we're still one of the 10 poorest counties in the United States. And poverty will remain, just like it does in other states. But here it's very prevalent.
So we've got the legislative session starting again in Austin. The legislators, the state legislators, meet every couple of years. Do you have any advice for those legislators that care about health care? What sort of policies would you like to see the state of Texas enact to tackle this?
I would like to, if they had any extra money in their budget, maybe to come and set up some mobile health clinics and treat people free of charge. Oh, that would be a tremendous help. They would be very, very busy. That would be nice if the governor could and congressman could help us with that. Oh, yes. Yes.
We get that for like 2 weeks a year, don't we? In July, when the armed services come down for their practice.
Army Day, and they're very busy. But they could be busy year-round if they came down. Yes, very much so.
So I covered an event as well, AltaCare Foundation. You spoke there. And did I hear correctly that you're writing a book, or you have written a book about your experiences?
Yes, I have. Steve, my wife Claire is a writer. 4th book is out, and she's encouraged me. And I started writing a book 20 years ago. I'm a little short-tempered with a computer. I write for 30, 40 minutes, but I've got it done. I was having lunch with Paul Maslowski, the producer of the movie Police Academy, and I told him a story, and he said, "Beto, title your book, Doctor, Do You Want My Lizard?" And there's a story behind that. So that's going to be the title of my book. And maybe if enough people buy it, I can make a movie and I can retire for good.
So that's not the story where you were treating the sister of the patient you should have been treating. We heard that story at the foundation as well. That's another, is that in the book?
Yes. I have 60 little vignettes, little stories, Steve. Funny, weird, sad, humorous, and these are all real, non-fiction. And it's as of today now, I've treated 1.4 million patients. 1 million I treated in New Mexico, and I have a lot of stories that I hope the reader will enjoy looking at and reading.
If you've treated that many patients, you must have a lot of stories.
I do, Steve. I do. And I'm proud of the fact, in practice, I never had an unlisted phone number. I got calls at 2 a.m, people worrying about their hemorrhoids. I got calls from a drug addict at 1 a.m, wanting to come talk to me, and I let him in the house. It was a wonderful thing, mingling with the populace and knowing that I was there for them. Let me add, when I got to Carlsbad, because I'm Hispanic, I mostly attracted, at first, poor Hispanic patients. Little by little, I started to attract everybody. And by the time I left, they gave me a big going away party. The mayor, Carlsbad is a very clean, good, healthy town, and I miss being there. But I love the valley. I was born and raised here, and I think the valley is, the metropolis now, the valley, is something to reckon with. Yes.
So have you got a name for the book, and when can we buy copies?
The book is going to be named, again, titled, Doctor, Do You Want My Lizard?
That's right.
And if we had enough time, I could tell you the story behind that.
No, we'll leave that and let the readers...
let them read about it.
There you go.
Yes.
And so when do you think it'll be published?
Steve, I'm going over it for the 12th time last night, and I'm making it, I want the reader to want to turn the page. And I'm hoping after the first of the year, by February, send it off to Penguin Publishers, see if they'll take it. And then it takes, about 4 months for hopefully about mid-year next year it'll be out.
Well, as the viewers can see, we are at DHR. I mentioned we're at the conference center. That being the case, tell us the impact, in your view, that DHR Health has made in the 20 plus years this hospital system's been here. What difference does this hospital make?
DHR was started or began as a very embryonic stage with 32 beds. Again, I'm going to mention Mr. Alonso Cantu had a lot to do with bringing this. And we've grown now. We have now 526 beds. Medicare, the government gave us permission to add another 500 beds. And if we ever add those, it'll be one of the biggest hospitals south of Houston, I think. DHR was promoted to be a doctor to be run by primary care doctors, referring to specialists. And the one thing that we all agreed on, all 600 of us, is to never, ever, ever turn down an unfunded patient. And we have treated many, many poor people at DHR. It's been one of the hallmarks of DHR that we treat everybody. Nobody has ever been turned away. And to me, that's the biggest reason we're here. So we offer health care to the whole valley in all modalities of health care. We have 16, 18 specialists of all kinds. And there's no need for some of our populace to have to go to San Antonio or Houston for treatment. We have every specialist available anywhere in the state right here at DHR. And we have become a Trauma 1 center 3 years ago. So I'm very proud to say DHR has grown to be a tremendous health provider, treating everything. Specialists on call every night. Nobody's turned away. And it's like being in New York. We have everything for everybody. But again, I'm going to emphasize, we treat everybody. Nobody will ever get turned away at DHR.
Well, Dr. Gutierrez, Beto, those are all the questions I had for today's conversation. Have I missed anything out? Is there anything else you would like to add?
No. One thing that I would like, the Valley has been kind of a stepchild of Texas regarding lawmakers and so forth. But slowly, this last governor has seemed to have taken Abbott more of an interest in the Valley. And I'm hoping that the Valley will become an integral part of all of Texas soon. We mean a lot. We have over 1 million people in the Valley. And we're catching up to everybody else. We've always been left behind. And I think from now on, Texas will be just as strong as San Antonio or Houston.
Well, that's a great point to end. A very optimistic point to end on, that the Valley's growing fast.
Growing very fast.
Well, thank you so much for today's interview. It's been fascinating to catch up with you again and to hear your story. Thank you.
Thank you, Steve, for having me.